Dr. Paschal, how are you integrating recent digital technologies into your practice workflow?
Right now in our practice, we just acquired the 3Shape scanner about 4 months ago, and we have integrated it pretty much to its fullest extent right now. That scanner is so remarkable, so fast, and produces predictable scans all the time for us. We've integrated it by using it diagnostically for diagnostic setups. We're looking forward to the day that we can actually put brackets on those diagnostic setups. Hopefully that'll come sometime pretty soon. Right now we can generate placement jigs by getting the brackets and aligning them right on the teeth, and basically generating a jig from that, and then do indirect bonding at any time. One of the most exciting areas that I've really enjoyed is it's totally improved and made our debonding sequence far more efficient for our patients. And what we've done is we're scanning the patients, sending it off, getting the brackets debonded or virtually removed, and then a fixed retainer comes back, or an Essex type retainer comes back, and on the day of debond, we take it off, take the brackets off, put the retainer in, and the patient's off. So that appointment is far less traumatic than it used to be for the patients, and in less time. Another area I'm really excited about.
Would you share
is
with
the
us what you
concept of
think
doing
can offer the
combination
clinician based on your
therapy.
experience?
And the 3Shape scanner and the OrthoAnalyzer software that comes with it has made this a far easier, achievable workflow within your practice as it stands today. And so what we're doing is we're finding if we take brackets off a little bit earlier in treatment, we can finish them out in 2 or 3, maybe 4 active aligners and get them out of their braces earlier. And as we all know, patients want out of their braces earlier. And this is a pathway that you can implement day one with your 3Shape scanner.
Would you share what you think can offer the clinician based on your experience?
So what can I offer the clinician? So I've used a prominent passive self-ligation system for almost 10 years. And the SLX bracket, when I first brought it into my practice, it has been such an efficient bracket and such a breath of fresh air for our practice. And we've been able to take all those techniques that we learned with that other system and apply every one of those techniques to our new system. And then on top of that, bracket placement is far easier with the SLX bracket. Our visualization during placement is just much more efficient. We're decreasing bracket debonds. And as a result, all that stuff's come together, and we're seeing treatment times that are up to 40% less than what I was seeing with the old passive self-ligation system that I had. The other thing I feel like we can offer clinicians is the motion appliance Class 2 and Class 3 has totally revolutionized the way that I treat patients. Under the old philosophy, you would adapt the transverse first. Under the new philosophy with the motion 2 and 3, what we're doing is we're doing AP first. And we're correcting the AP correction within 3 to 6 months, depending on the appliance you use. And then we're getting out of that appliance, getting them into braces, and they're in a Class 1 molar occlusion from day one in brackets. The treatment efficiencies that offers are amazing, and an amazing impact on your practice workflow.
What does Henry Schein Orthodontics bring to the table that you just can't find at any other orthodontic company?
One word: partnership. In today's corporate-driven world that we're seeing a lot of direct-to-consumer products actually being not only marketed, but in essence sold directly to patients, Henry Schein is not following that model at all. They are a true partner of the clinician. They are interested in making our practices better, more efficient, and bringing products to market that also have those efficiencies built in for improvement of not only your own practice efficiencies in your business model, but also just excellence and care for your patients. So you can deliver a high quality result to your patients with a true partner in orthodontics. Orthodontics is changing rapidly, and Henry Schein is one of those partners that is changing rapidly right along with you. They are looking ahead to technologies on a consistent basis. They're trying to see what the whole landscape is. With the power of Henry Schein and the company and the focus that it has the ability to not only be a bracket manufacturer or not only be a manufacturer of appliances. They have the ability to look at the whole landscape and bring multiple technologies to our business. And this is going to do nothing but help us in the future. So stay tuned.
iCat is a big part of your practice, and you use it daily. How does integration with 3D imaging improve your practice and results for the patient?
Well, I hate to be so basic about this response, but we work in a 3D world clinically, and the iCat is a 3D X-ray. And yes, that seems basic the way you say it, but once you get used to using the iCat, you know, things like measurements and all the stuff that we were traditionally trained on with cephalometrics and looking at things and trying to extrapolate where stuff was, all that stuff just disappears with an iCat. So you see things three-dimensionally, you can rotate things around, you can change the position. If you have an impacted tooth, you know, specifically a canine or whatever, you know exactly where it is. And so that makes predicting where the canine is going to be a whole lot easier. And you know, in my practice in particular, I do a lot of canine exposures and other tooth exposures. So it increases my clinical confidence doing things of that nature as well. But I don't think I would go back to practicing without an iCat. That would be one of those technologies that I don't ever see getting rid of.
In the field of orthodontics, you're probably considered an early adopter. How do you plan to convey your vision for utilizing technology and new devices to the orthodontic community?
You know, how do I plan to convey it? Basically, just talking about it. You know, the way that I represent what I do in my practice is I like to think it's in a very authentic way to represent it. You know, pretty much what you see is what I do on a daily basis. It's not created specifically for Henry Schein or specifically for my presentations. You know, and one thing about my office in particular, which is not necessarily unique with everybody, but is definitely an early adopter thing, is change management is a way of life at our office. My staff knows that at any given time, heck, it may happen when I come home from this meeting, there's going to be a litany of things that we implement day one when I return. And my staff is used to this. So if you don't have change management as a part of your culture, it needs to be a part of your culture in the future, because change is happening very rapidly and it's going to do nothing but increase.